see. Oh, that's better. You can see us a bit more there. I'm not even sure I'm on mute.
Hi there. Someone let me know if you can hear and see us.
Is anyone there?
Yes. Okay, thank you. So hi there, my name's Tori Heppel. I'm the lead nurse for early pregnancy here in Oxford, and this is Mandy, who's one of the advanced nurse practitioners in early pregnancy. It's our first time doing a live stream, so please bear with us. Oh good, lots of comments saying you can hear and see us, that's fab. So I just want to say before we get going that some people might find some of this a bit upsetting, because that's kind of the nature of what we do in early pregnancy clinics, but we will talk to you about the support services that are available to you if any of you are affected by what we say. So we've been asked to talk to you about our early pregnancy assessment unit. So I'm going to give you a bit of a background about what we do and then answer questions as we go along. So our unit moved out from the John Radcliffe Hospital about 2 years ago, and we live in the health hub at the Rose Hill Community Centre. We see women in early pregnancy up to the 16th week, and they come to us with things like vaginal bleeding or abdominal pain. We see women that have suffered previous ectopic pregnancy or molar pregnancy, and women that have had recurrent miscarriage in the past. You can self-refer to our service via the phone. You have to have an appointment before you attend, but you can always call us. Some women are also referred by their GP or A&E or community midwives and other early pregnancy services like IVF units and things. Since we've moved out, we've had really positive feedback about being away from the maternity unit, again due to the nature of what we do here. So women really like coming here rather than back in the maternity unit where we were before. And it's a sort of brand new purpose-built unit with a lovely view and very spacious and things. So very different from when we were at the JR. We've got a lovely team of healthcare professionals here. All have had experience of working within women's health, some of us for many years. It's mostly a nurse-led service, but we do have some specialist doctors here, and we have ultrasonographers from the John Radcliffe come down a couple of days a week as well to work here. Some of our nurses have been midwives before in the past, and some of them are also trained in scanning, so they'll be doing your scans when you come. So I just wanted to go through the pathway of what happens when you come to our unit. So you start off by either calling us or your GP or whoever refers you, and when you come through on the phone, an experienced nurse will go through a set of questions with you and decide the best action needed. So many of you will need to come in to see us. If you're given an appointment, you'll come to Rose Hill and we'll give you instructions because things have changed slightly due to the COVID-19 pandemic. You'll come to a door with a doorbell, you'll ring the doorbell, one of our nurses will come and collect you and they'll be in PPE. When you come through, you'll be asked to do a urine specimen, so come with a semi-full bladder, and then we'll get you to take a seat. We've planned our waiting room so that there's at least 2 metres between patients to protect you all. You take a seat and then the nurse will call you when they're free and they'll go through your full history with you. When they've done that, most women will need a scan, so you'll go through and have a scan. The person that's scanning you will have full PPE on. We'll tell you a bit more about that later. When our healthcare professionals are seeing you, we will maintain a 2 metre distance from you. After you've had your scan, a full explanation and a plan of care will be given to you. And you might need to have some blood tests or further follow-up with us, but we go through all that with you. And then when your appointment's finished, we escort you back in PPE back to the door that you came through. Many women, just because it's quite an anxious time, they might not think of everything that they wanted to ask when they're here, or they might forget what we've said, so it's fine to call us. That's what we're here for, and we're here 8 till 6 Monday to Friday, and they can always call us. We always have a nurse on the desk to answer any questions or if people have problems. So coming to an EPAU can be quite a stressful and anxious experience for people. We see around 4,000 women a year here, and national figures suggest that about half of all women will experience some bleeding in the first trimester of pregnancy. That's an awful lot of women, and but reassuringly, about 75% of those women that have bleeding will be okay. The pregnancy will be okay when they come to us. But unfortunately, sometimes this does result in miscarriage, and that happens in about 1 in 4 pregnancies. So it's quite a common thing that happens. And about 1 in 80 women, their pregnancy results in an ectopic pregnancy, and about 1 in 600 will result in a molar pregnancy. So there's lots of women having these sad times and sad losses. We can offer support here in the clinic for that while you're here and over the phone. We also have a lovely group of counsellors attached to us, and they are down at the JR, and patients can self-refer to them. So people can always ring in and get their number, and we can give you that, and you can self-refer yourselves. We also refer our patients on to charities such as the Miscarriage Association and the Ectopic Pregnancy Trust. They're an amazing couple of charities that give really good advice, really good source of support for women. So we always encourage our women to use those charities. We take part in the Baby Loss Awareness Week in October every year to sort of raise awareness of this sad time, and in remembrance, and to help educate people really about this part of pregnancy. And we're working towards the National Bereavement Care Pathway in the Trust as well, so that will be something that comes into place. I'm just going to hand over to Mandy just to talk about the main question that we've had and why we've been asked to do this is just the changes in our service due to COVID-19 and what differences there are in our practice. So Mandy's just going to talk to you about that.
Hello. So I think I'll just start by picking up one of Tori's final points was the counsellors. So they are still running their counselling service. We're not actually taking calls because they're working from home. So we can give you their email addresses. You can self-refer to them through email, and then they'll call you back. They're really good. We've had really good feedback from the women that have used that service. They're also doing their consultations over Zoom. So although you won't see them face to face, you'll get to see them like we're talking to you, and you can have a counselling session that way. People find them really invaluable, so sometimes it's worth biting the bullet and actually putting yourself forward for something like that. Things have changed quite a lot for us, starting to settle back down again. Initially, just before we went into lockdown, we moved our clinic back to the John Radcliffe, and that was just in case there was a lot of issues within the centre or a lot of staffing problems. Luckily, that hasn't happened with us, so that's great. But we now have moved back to Rose Hill. We moved back over the weekend just gone, and we've now been back here a full week. So if you do need to come to us, it won't be at the John Radcliffe unless it's a weekend clinic. And we will be back in our usual home from Monday to Friday, 8 till 6. So Tori said that you self-refer and then you speak to one of the nurses, and then so the only added questions that we ask at the moment is if you or anybody in your household has got any symptoms of COVID, so whether that's a cough, a temperature or loss of smell. So if you have got those, we're not saying we're not going to see you, there's just a different protocol. And it would mean that you wouldn't be seen at Rose Hill. If you were showing symptoms, we would actually see you at the John Radcliffe on the gynecology ward. And there's a whole system set in place for that. And if that was required, then we would tell you exactly what to do over the phone. So don't panic if we're not going to bring you here. We will still see you. That is always an option. It's just that we won't see you in this clinic. So another big thing for us, a lot of ladies have a scan and we know that the pregnancy is intrauterine, and quite often we then scan them again later on to see what the pregnancy does. Now if we see a pregnancy that's inside the uterus and we're happy that it marries up to someone's dates, then we will unfortunately not rescan them until their 12-week scan, until their nuchal scan. That is very difficult for us because we're very used to following up pregnancies and letting everybody know exactly what's happening. but we are trying to reduce the traffic through the clinic and through hospital to protect yourselves and us from COVID-19. So that is the reason why, unfortunately, we're not rescanning ladies as often as we would have done previously. We're also, unfortunately, not routinely offering surgical management of miscarriage. We're still offering conservative management, so let nature take its course, and also medical management. So we give you medication here in the clinic, and then we hospital. Unfortunately, we know there's a... Hang on. Oh, we're back again, sorry. Unfortunately, we know that there is a failure rate along with a lot of the treatments that we offer. So we're not saying you can't have surgery at all, we're just saying that we are dramatically reducing it, and it's not a routine option at the moment. As Tori was saying before, we will be wearing PPE, so when we go and greet you at the door, we will be wearing a mask, and then during scan, we'll be wearing a mask, sometimes extra goggles or a visor, plus an apron and gloves. I know it seems really odd, and I know during your scan, when it's dark, it probably looks even weirder. But unfortunately, to protect you and ourselves, that's what we have to do at the moment. Also, when you're not in scan, when you're having a chat with one of us, we will still be wearing a mask and potentially apron and gloves as well. So just be wary that we're all just going to look a little bit strange for a little while, and we're finding it really uncomfortable. We want to be able to converse with you properly and show our emotions, and it's very difficult to do that with you only seeing our eyes. So we're really sorry if it feels a bit impersonal. We're trying our best. In line with the trust, the Oxford University Hospitals guidelines, unfortunately no one can attend the appointment but yourself. So sometimes we're having to use language line in case there's a language barrier, but unfortunately we're not allowing relatives or partners in with you. That includes children as well. We're really sorry about this. We are trying our best. We will give you pictures if that's what you want, so you can share the experience with your partner once you leave, but unfortunately you won't be able to video the scan either. We're still here to support you, and I know that feels really tough, but we're trying our best to support you through this, and I know your partners aren't there, and it's really heartbreaking, and it's really hard for us, but we just want you to know that we're really sorry about all of that. Oh yeah, one more thing, is that previously if you'd had any pregnancy symptoms of maybe some very light spotting or maybe a little bit of cramping, we would have brought you in for a scan. Unfortunately, again, to try and reduce the transmission of COVID-19 and also reduce the traffic through the clinic, we're unfortunately not seeing everybody that calls us up. If your symptoms are quite mild, we will get you to monitor them, but obviously you can contact us at any time. Our telephone number, we're physically in clinic 8 till 6 Monday to Friday and a Saturday and Sunday morning now. But out of those hours, our number goes through to the gynecology ward, so there is someone there 24 hours a day, 7 days a week. And it's also really important to note that A&E is still open. There is a separate entrance for patients that we think might have COVID and ones that we don't. So it's important that you know that service is still there, and I think Tori's just going to expand a little bit more on that now.
So I think we've all heard, on the news and things that people aren't attending healthcare settings so much because they're scared or they don't want to burden. But actually there's times where you do need to, and early pregnancy is one of those times that if you experienced very heavy bleeding, if you had severe abdominal pain, you felt dizzy or you fainted, or you have any pain up in your shoulder tips, they're all symptoms that you need to seek immediate medical attention, even if it was in the middle of the night. So if you're okay and we're here, you can call us and we would guide you to the emergency department if we felt that was necessary. But if it was in the middle of the night or something, you must still go. You must go. It's very important that you still seek attention if you're concerned. A little something else that we just wanted to say about the early pregnancy unit. The Horton down in Banbury do have an early pregnancy unit as well, but they are not self-referral, they're GP referral. You have to see your GP before you go there, but they do have a service down there too. I'm just going to see if there's any questions. I'm not sure. Let's have to scroll here, I think.
You need to go the other way.
Do I?
So go down, because I think the newest ones pop up.
Okay, I don't think we've got any questions.
Has anyone got any questions they want to send us in?
this one?
So on the bottom where the circle is, there's an arrow on the
Ah.
left.
Oh yeah, there we go. No, I don't think we've got any questions.
We'll just wait a moment in case you
in
are
case
trying to type or thinking of anything. What we can do actually, we can't do it at the moment because we've got our clinic running.
Oh yeah.
But we could do a short video to show you what our clinic looks like, what to expect when you arrive. We could do a short video and always post it afterwards if people think that might be quite helpful. Obviously we are a bit different to a hospital, but it's worked for us for the last 2 years and it's doing really well.
So I think that's, I'm just going to have a scroll again just to check that there aren't any questions there. No, I don't think there are. Okay, thanks for listening.
Thank you.